Hey there, welcome to our channel. Thanks for tuning in today. We appreciate you taking the time to learn about important health topics. Let's talk about something super important, but often overlooked. Pelvic Inflammatory Disease, or PID. It's a topic that deserves more attention. So, what exactly is PID? You might have heard the term, but not fully understood what it entails. It's an infection of a woman's reproductive organs. This includes the uterus, fallopian tubes, and ovaries. Think of it as an umbrella term for infections that affect the uterus, fallopian tubes, and ovaries. These infections can cause a range of symptoms and complications. It's pretty serious and can lead to long-term health problems if not treated promptly. These problems can include chronic pain, infertility, and ectopic pregnancy. Now let's dive into the types. Understanding the different forms of PID can help in recognizing and addressing it early. PID can be acute, meaning it comes on suddenly and is quite severe. This type often requires immediate medical attention, or it can be chronic, which means it lingers for a long time and can be less intense but still damaging. Chronic PID can be tricky because its symptoms might be milder but persistent. What causes PID? The most common culprits are sexually transmitted infections like chlamydia and gonorrhea. These bacteria can ascend from the vagina or cervix into the reproductive organs, but it can also be caused by other bacterial infections that find their way up into the reproductive organs. This can happen after childbirth, abortion, or other gynecological procedures. Here's where things get interesting. Risk factors. Knowing these can help you take preventive measures. If you're sexually active and under 25, you're at a higher risk. This is because younger women's cervixes are not fully matured, making them more susceptible to infections. Multiple sexual partners or a partner with an STI can also increase your chances. The more partners you have, the higher the risk of encountering an STI. Even douching, which some think is a good hygiene practice, can actually push bacteria further into the reproductive tract, upping your risk. It disrupts the natural balance of bacteria in the vagina. How can you prevent PID? Prevention is always better than cure. First off, practicing safe sex is crucial. This means using condoms consistently and correctly. Use condoms consistently and ensure both you and your partner get regular STI screenings. Early detection of STIs can prevent them from causing PID. Good hygiene is essential, but avoid douching. Maintaining the natural flora of your vagina is important for preventing infections. And finally, if you notice any symptoms like unusual discharge, pain during intercourse, or lower abdominal pain, see a healthcare provider immediately. Early treatment can prevent complications. Precautions are your best friends here. Being proactive about your health can save you from a lot of trouble down the line. Regular checkups can catch infections early before they turn into something more serious. Make it a habit to visit your healthcare provider regularly. Also, keep an open dialogue with your healthcare provider about any and all symptoms you might experience. Don't hesitate to ask questions or express concerns. In conclusion, PID is no joke, but it's manageable with the right knowledge and precautions. Being informed is the first step towards prevention. Understanding your body and taking preventive steps can go a long way in safeguarding your reproductive health. Knowledge is power. So stay informed and take care of yourself. Thanks for watching. We hope you found this information useful. If you found this video helpful, make sure to like, subscribe, and share it with someone who might benefit. Your support helps us create more valuable content. Stay healthy and see you next time. Take care.